Good morning, doctors, students of homeopathy, and friends of homeopathy. Today is the 1704th day of uninterrupted daily webinar of IFPH. And today's our speaker of the day is the pride of IFPH and our patron of IFPH, the most sought after teacher of our time, Dr. Issac. He was a former head and professor of Organon of Medicine, Government Homeopathic Medical College, Trivandrum, and he was the member, faculty of homeopathy, Kerala University, former CCH member, and he is a visiting professor at various foreign universities. He do have students around the globe, and we are very happy to welcome him. Today's our topic is constitutional prescribing. I welcome you all to this session. Sir, you can start.
Okay, thank you, Dr. Bindaraj. See, today our topic of discussion is constitutional prescribing. And see, the main difference between other systems of medicine and homeopathy is we are the system which goes to the root of the problem. Even in foreign countries, many countries, people ask this question, what is the difference between homeopathy, allopathy, and other methods of treatment? So the problem here is, when we look into the origin of diseases, we find that the 50% or more, or almost all the chronic diseases, comes from the previous generation. Now we know that the medical field is trying to locate the oncogenic gene or many genes that are coming through the previous generation to the next generation, like that. At a time when Hahnemann wrote the chronic diseases, nobody believed that most of these chronic diseases are hereditary in nature. And now we know people who have, if the father has diabetes, the son or the child has 25% chance. And if both the father and mother has diabetes, there is 50% chance, like that. So now the main problem in the world is the chronic diseases, which constitutes around 70% of the problems or diseases. So where the homeopathy stands, or what is the scope of homeopathy in this area? We are the system which can do or which can cure a chronic disease. And of course, it depends on the stage on which the patient is coming to us. Even cancer in the first stage, second stage, are cured by our medicines. And so that's why I said it depends on the stage also, even arthritis. After the degeneration has gone through and when it got advanced to a greater level, it becomes more difficult to cure. Or sometimes it may not be able to cure. We may not be able to cure. But still, we know the antibiotics is there for the last, it is going to be 100 years now. If I remember correctly, antibiotics came in 1928 or something. So it is going to be 100 years. And now there is a campaign against antibiotics. Even the people who are producing it are telling us not to use it too much. So one round is over, 100 years, almost 100 years. And we see that the pharma companies and the whole world and even the WHO is advising not to take antibiotics unless it is very necessary. So this situation is changing. The paradigm of the things and diseases are changing. And we see that there are lots of chronic diseases coming up and there is no cure for that. In allopathy, they have the painkillers, anti-inflammatory drugs, everything. Or even a diabetes where they reduce the blood sugar level, but the disease is progressing and producing complications in the, like retinopathy, neuropathy, many complications. And people are living until the age of 85, 90, and the disease starts at the age of 40, a chronic disease starting at the age of 40, and they have to take, or they are under constant medication for the next 40 or 50 years. So this is the situation now. So this is the area where homeopathy is coming up in a big way in the foreign countries, in Europe and all these countries. Because people know that the other systems of medicine can just palliate the symptom only. And actually it works in a superficial level, just suppress the symptom, not going to the deeper level or trying to cure the case. So this is the biggest problem now which we are facing. So this is the area where homeopathy steps in, because homeopathy is the one system of medicine which not only, we know that our own prescriptions are sometimes, mainly there are 5 types of prescriptions: etiological, symptomatic, miasmatic, constitutional, and then pathological. Pathological prescriptions we make in the final stages of diseases where there is no hope of a complete recovery. So here, the first thing, the etiological prescription, then we go to a symptom. If there is an etiology, we give an etiological prescription. If there is no etiology, we go to the symptomatic one. And if after giving the symptomatic and then the miasmatic, then the constitutional. So constitution is the final one, which completely cure a chronic disease. I'm talking about chronic disease because acute disease, as all of you know, comes from certain external factors, or if this acute disease is recurring again and again, it should be considered as a miasmatic chronic disease. So when we treat the chronic diseases, to complete a cure, what we need is the constitutional treatment. And also when to start this constitutional treatment is a very important thing. In many cases nowadays, what we see is a combination of many, many diseases, 4 or 5 diseases, not one single disease. Very few people are coming with a single disease. Most of them are coming with 3 or 4 chronic diseases. Here also, the problem now is when to switch on to the constitutional treatment. Because when a person is coming with a severe pain and all, mostly we give a symptomatic treatment so that the pain is relieved, and then we go to the miasm, then to the constitution. This is the step-by-step way of treating chronic disease. That's why many authors say that there are many layers in the constitution, and we have to cover these layers or remove these layers one by one. So what is a constitution, or how a constitution is formed? When an individual's first thing is the zygote is formed, and along with this, you are getting all the genetic material from the father and mother. Along with their diseases, their deficiencies, their own, whatever is not there in a proper way also comes in. So there starts the constitutional problems. And that is the constitution. Constitution, we call it the mental physical makeup of an individual is called the constitution. That is decided in the zygote itself. And then what we get is the external factors which produces other diseases. Some people get more and more layers on this constitution, depending on their life experiences, depending on their life, the way of life, many things. But mainly these genetic factors decides our chronic diseases. That's why I said constitutional treatment is given mostly in chronic diseases. In acute diseases, it may not be needed always. Then what is constitution? Some people may ask this question. Everything, mental, physical, and makeup of that individual constitute the constitution. In Ayurveda also, they call it Prakriti and all those things. So we have our own theories about constitution. And when to give these constitutional remedies? Or what are the advantages of giving a constitutional remedy? The first area where you can give is during pregnancy, taking into consideration the couples or the parents' deficiencies, diseases, and everything. we can start this treatment, constitutional treatment there. It is like it is also a miasmatic treatment. We are treating the miasms in the constitution of the parents, and that helps a lot in minimizing the hereditary diseases as well as the constitutional problems, which we inherit from the previous generation. Because as I told you earlier, nowadays this is the biggest problem, the chronic diseases, which never leaves the system unless homeopathically treated. This is the area, exact area on which homeopathy is becoming popular in the West. Because everybody knows what happens when you take a diabetic medicine or a blood pressure medicine or a cholesterol medicine or an arthritis medicine or allergic medicine. They know that there is no cure. But for temporary relief or suppression of symptoms, they take it. But now they are looking for the next option. People want a cure. And that's where this kind of things are coming up. So the next one is the use of constitutional medicine comes in children, where they have less layers and easy to remove these layers. Even the miasms are entering the constitution and producing chronic diseases. So the weakness in the constitution helps this miasm to enter the constitution and produce symptoms or diseases. So the ultimate correction should happen in the constitutional level. And that is what homeopathy is doing. Of course, there are patients, around 50% of our patients also, does not give us enough time or does not allow us to go to the constitutional level. Because once they get a relief of the symptoms or the disease, they just stop. And again, it comes back after 2 years, 3 years or something. But if we can give a continuous treatment, like a symptomatic, miasmatic, constitutional treatment, we can give a complete cure for many of the diseases. Then the next one is in the chronic diseases, as we are doing every day, the treatment, the constitutional treatment in chronic diseases. We all know that in aphorism number 221-22, Hahnemann is giving a very clear instruction on when to go to the miasm, when to go to the constitutional treatment. Because as we know, constitutional treatment means digging up the whole disease or the tree with its roots. And this is not possible in an acute condition. During an acute condition, as said in aphorisms 221-22, give a superficial remedy that can cover the symptomatology. And even our Allen's keynote and all, we hear that it is better to start with a vegetable drug, and such directions are given by Allen, mainly because of this. One problem is homeopaths also fail many times because they sometimes very hastily they go into the miasmatic and constitutional treatment. And this patient cannot endure or tolerate the whole thing. Although we are aiming at a complete eradication of the disease, there is a time to give this remedy, time to go to the constitutional remedy. This is one of the most important things one should know in constitutional prescribing. When we go to a constitutional prescribing, what we expect? We are expecting this disease to be rooted out completely. And whether it is possible in an acute condition of a chronic disease. So that is the reason why Hahnemann is specifically giving this direction. I don't know how many people have looked into that or how many people have understood the real gravity of that particular two aphorisms. Because many times homeopaths, as all of us know, that a constitutional treatment is the final one or the one which can cure completely the whole disease. And we wanted to give it. But there is a warning by Bonnie Hassan. What he says is, don't try to uproot the whole tree one shot. Don't try to uproot the whole tree. That means don't try to uproot the whole disease one shot. What he says is cut the branches first, then go to the roots. This is a very, very important statement by Bonnighausen. You know, Bonnighausen was a contemporary of Hahnemann. And it's a very, very important thing. Our failures, why it comes, we have to analyze this. And there is an answer in for all our failures in the literature of our great masters. And that is the reason why he says, and there are many others now saying that remove the layers first and then go to the core or the constitution. So how to give and when to give the constitutional remedy is very, very important. But at the same time, constitutional remedy is the remedy which can cure the disease or to eradicate the disease in the constitution. And the constitutional remedies are given for constitutional defects. Only people who have a constitutional defect will get the miasms, and the miasms will grow and produce diseases. So this constitutional defect is the core problem or the root problem, which we are trying to correct with our medication. So if you give it during pregnancy, it works very well. Then also in children, even our Dr. Elizabeth Wright, in her book and brief study course in homeopathy, what she says is, give your children constitutional remedies in high potency once in a while. That will purify the constitution or it will make the constitution more healthier. And in such healthy constitution, there is less chance of getting diseases. So these are very important things. Then when to switch on to constitutional remedy in a chronic disease. You know, for example, arthritis. The first remedies which we give usually are Bryonia, Restox, Causticum, Pulsatilla, such remedies. But once they did what they can do in the, we call it a superficial level, but patients are more happier with these remedies because it gives it relief for the symptom. The pain, swelling, everything goes off. And then there is a time when we can look for the next step. So following this, you go to the miasmatic remedies. For example, in an arthritis, it's a psychotic problem. We go to Thuja, Medorinum, or even nitric acid or some remedies. Even after that, the real constitution we have to correct. Why we have to correct this constitution is we don't want this problem to come back again in this patient. So what we do is we look for the, it can be a constitution like phosphorus, silicea, calcareous carb, lycopodium. These constitutional remedies, when we look into that, we find that they are all polycrust remedies. Most of them are polycrust. Most of them are trimiasmatic. And these are long-acting drugs. Of course, we get that long action when we go to the higher and higher potencies. So these higher potencies, when these remedies are used in higher potencies, it goes to the inner level or the highest level and the deepest level and try to correct from that. That's why in many cases, we used to finish the case with a mineral remedy or a nose wash. Nowadays, we know lycopodium is being one of the most important drugs in use now because you know the lycopodium constitution. Intellectually keen, but physically weak. There is a sentence like that. So these people are highly successful people. They are intelligent. They can, you know, whatever job they do, they become successful in it. Good businessmen, good politician, good doctors, good lawyers, all professions. The best is lycopodium people. But at the same time, they are physically weak. So that's why this one sentence gives you an idea about the constitution of lycopodium. Intellectually keen, physically weak. The same thing when you go to the women constitutions. We find many corresponding things or parallel things in women, especially in natramur. Nowadays, you know, a woman in the reproductive period, the most important remedy that comes is natrum muriatica, mainly because of the emotional aspects as well as the physical aspects. Because in a constitution, when you select a constitutional remedy, we are selecting it based on the mental generals and physical generals, not the particulars. The mental generals and physical generals. Mental generals, you know, will, understanding and memory. And the physical generals, we know the menstrual complaints, the thermal reactions, the moon phases, reaction with the moon phases, the side which is mostly affected. All the general physical general things are taken into consideration. So when we prescribe a remedy on a constitutional level, what we are looking for is the mental general and the physical generals. And from there, you know, nowadays, one of the most important or most common disease which we see in women now is hypothyroidism. In hypothyroidism, we know the symptoms like hair fall, irregular menses, depression, putting on weight, tiredness, weakness. So these are the main 5-6 symptoms of a disease. And the most important remedy which we see in hyper or hypothyroidism, which is seen in women, is natrum muriatica. You look at natrum. What is the constitution of this natrum? The natrum constitution is a melancholic constitution. And they are depressed. They don't want to mingle with people. They want to sit alone, moody people. And the reproductive period. All these things are coming up together, a hot patient. So these are the main indications on which you can prescribe a remedy constitutionally. And natrum is one of the main remedies now. As I told you, lycopodium in men and natrum in women nowadays covers many things because the constitution is like that. Then we have the constitutions like Silesia. So we are taking into consideration the thermal reaction of the individual before when you come to a constitutional remedy. Even in Ayurveda, they call, you know, Shida Prakriti, Ushna Prakriti. So there we find certain similarities in other systems of medicine also when we look into the homeopathic philosophy. The Ayurveda people also are looking for Prakriti. They are also looking for this hot or chilly, the likes and desires of the individual. Why certain people like salt, some people like sweet. All these have to be taken into consideration when prescribing a constitutional remedy. So here, one must be very clear. In an acute disease, mostly we prescribe on the etiology and symptomatology. And in a chronic disease, the real treatment comes after this etiological or symptomatic. The real treatment starts. The miasmatic treatment or the constitution and the constitution treatment. So that's why I said only after a prolonged treatment of the symptom, then the miasm, then the constitution, we can say the patient is completely cured. Why Hahnemann came to this? We all know that before writing the chronic diseases. For 12 years, he was doing research on why certain people, the diseases are coming back again and again. Because many of us have not gone to the miasmatic or constitutional level of treatment. Or the patients sometimes don't allow us. Because once they get relief from complaints, they tend to stop the treatment. So as a homeopathic doctor, we are supposed to tell the patient themselves that we are just clearing the symptoms first and then we are going to the next level. Only such a treatment can cure the chronic disease. For example, in an arthritis case, many times after the first level of treatment, we are going to the remedies like miasmatic remedies like thuja, medorinum, nitric acid, all these remedies are there. And then we go to the constitution. The constitution can be a phosphorus constitution, or a silicate constitution, or a calcarea constitution. Whatever it is, we have to go to the next level. So these 3 levels of treatment has to be done to get a complete cure for the chronic disease. As I told you earlier, in chronic disease, mainly we are thinking of this constitutional treatment, because acute diseases, half of it is not due to any constitutional defect. So what is a constitutional remedy? Some people may ask this question. A constitutional remedy is the one which can clear the constitutional weaknesses in an individual. Other remedies does not qualify to become a constitutional remedy. Another important thing is why and when to, I also already told you when to go to this constitutional treatment. That is being explained in this aphorism 221, 222. The miasmatic treatment, when to switch on. What happens is, a patient may be, some people may ask the question, even in the West, many people ask the question, what is my constitution? Many times we cannot say that, because this constitution is covered or masked with many other problems. Sometimes alcoholics, or sometimes their exposure to the different types of weather, too much cold, too much heat. All these can modify things. So first we have to remove these modified symptoms, and then we have to come back to the original constitution. So that's why the many doctors say, remove the layers first, then come to the constitution. So the main problem here is many people just switch on to the constitutional remedy from the very beginning. Some people never think of a constitutional remedy because they are getting results or symptomatic relief. Both are wrong in a way. Sometimes we can start the treatment with a constitutional remedy, provided there is no acute things to be cleared. If the symptoms are, as we know, the disease starts in the constitution. With the deficiency of or weakness of a constitution, the miasm enters the constitution and produce symptoms. And for this group of symptoms, we call it disease. So first the constitution, then the miasm, then the disease symptoms. So the treatment also should go in the reverse order. That means first the symptom or the etiology, then go to the miasm, then go to the constitution. But in some cases, like I told you earlier, like a remedy like lycopodium, it can work as an acute remedy. It can work as a miasmatic remedy. It can work as a constitutional remedy. So the importance of such remedies, these constitutional, deep acting, tri-miasmatic remedies are more and more we are seeing that in our clinic. In olden days, I used to go to many experienced doctors and sit with them. And what I have seen is many homeopaths, when they mature or after the 25 years or 30 years of practice, they are more confined to certain medicines, around 25, 30 medicines. Mostly the medicines which Hanuman was using during his time. And mostly mineral remedies, no salts, such remedies. They are confined to that. Because one very eminent doctor told me one time, we are in a way, we are going around and around and around. So if you know the constitutional remedy, and if there is no much discomfort or much troublesome symptoms, straight away why can't you go to the constitutional remedy? Also, one doctor told me, because I have the habit of going and sitting with them, and I was a young doctor, or I got the opportunity to be with many experienced doctors. So most of them in the last phase or in the after 35 years of practice. They mainly practice on 20-30 constitutional polycrest, deep acting, miasmatic remedies. But in the beginning, we are all, thinking that we can give a better relief in a short time. We used to give some remedies, and finally, anyway, we have to go to these remedies. For example, like agar card. Every constitutional drug, we must be able to differentiate with the other drugs. Calcare carb is one remedy, where when the obesity, to put on weight, they have a tendency to put on weight, profuse menstruation, craving for eggs, pot-bellied abdomen, sweating, sour smell. All these are the whole things that are pertaining to the whole body. And this constitution has a tendency to get certain diseases. For example, a phosphorus constitution. We see mostly this phosphorus constitution is getting gastric complaints, respiratory complaints. These are the two complaints for which phosphorus or area or sphere of action of phosphorus, although it is a polycrest. Also the spinal cord, the burning of the spinal cord, many things. There are general symptoms like burning. We know phosphorus belongs to one of the trio of burning remedies, along with the arsenic and sulfur. So when we go into the constitutions, we see that there are certain constitutions have a tendency to get a particular type of disease or a disease on a particular organ or a system. Lycopodium, for example. Although lycopodium is a polycrest remedy, we find most of the lycopodium patients having bloatedness, flatulence, or gastrointestinal complaints. Of course, lycopodium can be used in other conditions also. But these constitutional remedies also have a sphere of action where there are certain systems are prone to get disease. For example, Nexomica. Any disease that comes with a gastrointestinal origin. Certain words and certain sentences in the Materia Medica are very important. Even when we read this Materia Medica, we don't really appreciate it or understand it. But over the years, when we practice, but nowadays we say that most of these complaints or the modern medicine is saying most of the gut problems, most of the things are coming from there. So this Nexomica, we know, if the patient had any complaint with a gastrointestinal origin, Nexomica is the remedy to start with. Of course, after Nexomica, we have to know the relationship like Nexomica lycopodium carbovate, or Nexomica lycopodium sulfur, or Nexomica sulfur. These are the relationships of Nexomica. We can go in different ways or angles depending on the symptomatology and the constitution of the patient. So these are the achievers in life, like Nexomica, lycopodium. These are the main achievers in life among the men remedies. Whereas calcarea carb, silicium, we don't find them in the constitution so much of hard work or anything. They are not intellectuals in a way. Because silicium, one of the most important remedies in autism now, where the child has aggravation during full moon or sweating of the palms and soles. All these symptoms we see. Even in autism, we know. There are some, it is the mineral remedies which comes to the top in the treatment of autistic children. Like that, when we look into the main chronic disease, what we see is we are living in an era of psychosis. See, here we have, when we read the chronic diseases, we understand that the SORA was the beginning, then the syphilis came, Then finally the psychosis came. And now the main chronic diseases, which the human beings are suffering from, comes from mainly psychotic or psychosis or psychotic minds. And when we see this thing in the constitutional remedy, we're looking into the physical, mental makeup of the individual. The total correction or the final correction comes from the constitutional remedies. And that is the importance of the constitutional prescribing. So identifying one's constitution is important, or differentiating the different constitutional remedies in the materia medica. For example, remedies which we usually find is in differentiation is silicea and calcareous carb. Some simple things can differentiate these two remedies. Like silicea is lean, calcareous carb is fatty. Silicea has sweating in the palms and soles. Calcareous carb has sweating in the head. So, like that, both of them difficult in comprehension. They are a little slow. Such things we see, there are very, very, very important comparisons. Also, this we see that in most of these bone problems, we see silicea, calcareous carb, then the phosphorus. All these are components of the bone. And we see a lot of similarities, and at the same time, we must be able to differentiate it also. For a full moon aggravation, we have silicea, we have calcareous carb. These are the two important remedies. Then comes alumina. So like that, this differentiating, the study of materia medica, at the final level, there are different levels in the study of materia medica. The final level is comparison and differentiation of these main constitutional remedies. And that is the ultimate level of the study. And that's if you study that way, because I already told you that chronic disease is the main thing that is going to be there in this world. That is the biggest problem. Otherwise, all other things, will, many therapies are there, but our uniqueness lies in the treatment of chronic diseases. And this chronic disease treatment, the ultimate goal is to give the constitutional remedy. And constitutional prescribing or constitutional prescription is the one which gives us a mileage when different systems are there. Maybe that is the reason why Richard Hughes said, homeopathic medicines are constitutional substitutives. Constitutional substitutives, which can remove these chronic diseases with its roots completely. So here the question comes, why there are so many people now coming to India for this alternative? Because we are the leaders in alternatives. And we have the Ayush ministry, only country which has got a ministry for alternative systems is India. And people are coming to India for treatment. Because they try everything and finally they come for this. This is the area where every homeopath has to concentrate. Because now we know many private practitioners used to say, we have dispensaries in every panchayat, we have all systems of dispensaries in every panchayat. But where is homeopaths should find their own space, an area where other systems cannot do anything, an area which is more in a higher level than any other system of medicine. These areas we have to identify, we have to locate, and we have to concentrate on that. And then only homeopathy can go to the next level. This is what, if you go to the outside India, what people want is this treatment, this miasmatic constitutional treatment, not just the relief of symptoms. Because nowadays, people are more assertive when they ask the question, whether you can cure this or not. This is the question. And all the barriers are going now because the knowledge is at fingertips and you can have a can consult any doctor in this world from your office or house. This is the next level. This is going to happen in a very, even artificial intelligence, many things are coming, and within few years this will happen. So where we stand and where we have the upper hand, we have to identify. This area we have to concentrate. And my request to all the youngsters and the new doctors is to concentrate on the constitutional prescribing and how to do it, when to do it, and how you can cure a disease completely. I think the time is over, already 45 minutes. And according to our plan, always 15 minutes for the question answers or something. We can discuss the topic. Anybody wants to ask any questions can ask now.
You can raise your hands, then that we can unmute you. We can interact with the speaker. So let me ask the question. First question, let me begin with the round. So first of all, we need to treat the acute symptoms, then the miasms, and then the constitution. It will be wise, isn't it, sir?
Yeah. No, it is explained like that in Aphorism 221 and 222.
Okay.
Where Hanuman says in an emotional problem, you can give Ignatia or Hyacinthus or whatever remedy you can, Belladonna or something. Then after, then don't think that it cured the case completely. Then you have to go to the miasm when the patient symptoms are completely free. This is what he gives. Clear direction is given.
So sometimes if we are treating the person, the symptomatology might be calling for belladonna. And recurrently, the person is being affected and the symptoms is calling again for belladonna. And the usual thing we do is just to switch to calcarea carb, a chronic, just to cut that thing. But if the calcarea carb, so
after belladonna, we gave calcarea carb or tuberculum. There comes the relationship of remedies, where belladonna and calcarea carb have similar symptoms, but calcarea carb, because it's a mineral remedy, has deeper level of action, can go to the deeper levels. And then you can think of an nosort like tuberculum, where the nosorts are more deeper, more wider action.
And you are the forerunner, you are the torchbearer who is always after Hahnemann in homeopathy, sticking to the principles, to the cardinal rules. I don't know, I follow always your ideologies, your way of prescription, the type of thing you always keep. And what you think that a lot of persons are using mixed medicines, means several type of one set of medicines for the same person at a time itself. What do you think? Is it good or bad?
Say, we don't find this in any in the writings of any authoritative authors. One thing. Have you seen any authoritative author like the first 10 authors in homeopathy, like Hahnemann, Ken, Clark, all these people, Bonninghausen, Stuart Close, nobody advocates that.
Okay, so here, Dr. Hariharan is here to ask the question. Dr. Hariharan?
Okay. Can I ask the question?
Yeah.
Okay.
Sir, I want to know any age barrier for this, for administering the constitutional medicine.
Yeah, that's a good question, because as when I told about the types of prescription, I said there is the etiological, symptomatic, miasmatic, constitution, and the last one I told is pathological prescription, which we make in the 4th stage of carcinoma, or when we see that there is no hope of a complete recovery. So in such pathologically advanced cases, it is better not to give a constitutional remedy. But if the patient is improving with other remedies, you can think of a constitutional remedy later.
Sir, another question. if I am saying that give first the constitutional remedy and then give the acute remedy, so it will act wonderfully. What is your opinion regarding that?
No, constitutional remedy covers both acute, chronic, and everything. And one more thing is, if there is a pain or a very troublesome symptom, sometimes the superficial remedies helps better. Because, for example, in a gastric ulcer patient, our first remedy may be Nexomica, aloes, or some other remedy, podophyllum or something. But later we go to sulfur or lycopodium or some other remedies. That is
Okay.
better to do like that. But that's why I told you about the statement of Boninghassen. What Boninghassen says is, don't try to uproot the whole tree one shot. Cut the branches. Cut the branches with your Nexomica or some other superficial, especially plant remedies.
Sir,
Many times
suppose-
they say better to start the treatment with the plant remedies because it doesn't give much aggravation.
okay, sir, very good, very good. But another doubt. Suppose we are cutting the branches, the exacerbating symptoms, the constitution will become a block, and the remedy will not act, and the acute symptom did not cure. What is your opinion?
No, there is the miasmatic block sometimes the constitutional. Then you can go to the constitutional or miasmatic, no harm. Even you can start if you are very sure, if there is no troublesome symptoms, then also you can start with a constitutional remedy.
Thank you, Doctor. Next is Dr. Ram Pravesh Shah. Sir.
Thank you, Dr. Binduraj, sir, and congratulations, Dr. Joseph, sir. Very good, describe the constitutional treatment. There are three angles. First angle, symptomological angle. It is very easily angle. Any homeopathic doctor. And second angle, miasmatical angle. Curative way of treatment. Miasmatical angle is a curative way of treatment. Chronic diseases. According to Hahnemann, approaching number 7235, pathological angle. There are three angle treatment. Pathological angle is a very difficult angle treatment. So, symptomological angle, chronic diseases, miasmatical angle is the necessary to start the highly covered miasm. There are three fundamental laws of miasm: flora, psychotic, and syphilitic. Flora is a background in every disease. Mother of all diseases is our flora. So, historic remedy, highly anti-historic remedy, sulfur. King of anti-historic remedy, sulfur. And queen of anti-historic remedy, surinam. And king of antipsychotic remedy, puja. Is called queen of antipsychotic remedy, medorinum. And king of antisyphilitic remedy, marxol. And queen of antisyphilitic remedy, syphilnum. It is highly cover of miasmatic diseases, a miasmatic angle. So, very, very thanks, Dr. Joseph sir. Very nice presentation. Constitutional treatment. Constitutional treatment is called other name of miasmatical treatment. Anything is the miasm.
Thank you, Doctor.
Belladonna, calcarea. Thank you, sir. Very, very thanks.
Thank you. One more thing I would like to add is regarding the miasm. See, when we look at this SORA, all the inflammatory conditions comes under SORA. All the degenerative conditions comes under syphilis. And all the neoplasm or new growth comes under psychosis. Very simple, because Even when Hahnemann came up with the 3 miasms, many people criticized it, but the latest pathology also says only 3 pathologies.
It's not audible.
Mute.
Yeah, please.
Full name of facility. Thank you, sir. Thank you.
Okay, thank you, doctor. Any other person to speak? You can raise your hands. Sir, constitutional state also will change. If we are treating a person with a constitutional medicine, and if that medicine works, we need to stick on to that medicine itself, raise the potency, or sometimes we need to take the case again for the next consultation for the repetition. What's your
Actually, when we give a constitutional remedy, we are trying to strengthen that constitution. And if taking the case again is okay, but usually what we see is the same constitutional remedy in higher and higher potencies, keep on strengthening his constitution so that he will not get the diseases in future.
Hello. Hello.
Yes, doctor. You can.
Okay. Can I ask a question?
Yes.
Sir, one of my question is that, can we change the constitution at any time?
No.
You
can modify the constitution, but you cannot change the constitution. You cannot change the height, weight, or anything. Because, when people go to gym or something, they put on some muscles and everything. Finally, they come to the same constitution.
Sir, any relation with genetic condition and the constitution?
Genetic is the constitution. Because you can only modify the constitution. By a better living or a bad living, you can improve or make it worse or something like that. Only modify, cannot change.
Sir, another question. If a cancer gene is in that person, can we change it to cancer from cancer at only growing? At any time, can we change the cancer genes from that person?
Oh, yeah. See, here, one statement by Hahnemann is there. What he says is, with our constitutional miasmatic remedies, if you give in succession, you can remove the diseases to a great extent and bring this patient to a comparatively healthy state of life. Comparatively healthy state of life. That is what he says. Because these miasms are transmitted for years and years through different generations. And you cannot just simply remove it with a 1-year treatment or 2-year treatment. But you can bring them down and bring them to under control by your constitutional treatment.
Okay, doctor. And we have a lot of very grave, aggressive stage of autoimmune diseases like SLE, multiple sclerosis, a lot of things. So for treating these things also, we need to, first of all, we need to cut the acute manifestations, then reach the constitution, or directly we need to reach the constitution for that.
I said it because many times when we, for example, a simple tonsillitis, a patient who is coming with a recurrent tonsillitis, you are giving tuberculin, 1M or 10M. And the next week, the patient is coming with the same acute condition. We have to change the remedy sometimes because there is severe pain or something. So it is better to remove these acutes first and bring them to a comparatively healthy state and then go for a preventive medicines like a miasmatic constitutional treatment. This is clearly explained by Hahnemann. Because this is a problem. When patients come to us, they come after several courses of antibiotics and many things. And if we start with a constitutional remedy, then we have to interfere in between when the acutes come. So better clear the acutes first, then go to the chronic.
Thank you, doctor. And one more person. We are having only 1 minute. Doctor, you can ask in that time frame, please.
Good evening, sir.
Good evening.
At times, a constitutional medicine may cover our etiology, acute symptoms, miasm, and constitution.
Okay. Then
Okay.
give it in the beginning itself.
Now, then at the beginning, we can give low potency.
Yeah, better to start with a low potency.
For
But
preventing the disease, high potency.
yeah, because we have an option.
Constitutional drug.
If you start with a low potency, you even if something else comes in between, you can give another remedy, you know. So that's why Kent says in his lectures on homeopathy philosophy, what he says is start with the 30 potency. That's what he says.
Okay. Sometimes a constitutional medicine can become anti-miasmatic also.
Well, no, usually these polycrests are all miasmatic constitutional remedies.
Okay. If during pregnancy we give constitutional medicine, means we can slightly change the constitutional nature and hereditary tendency.
Yeah, especially in parents or couples who are having autistic children. Usually in some families, we see the first child has autism, second also has. In such cases, it's very, very effective. I have found in my practice that after giving the constitutional miasmatic remedies for the mother during pregnancy, we could minimize many, many genetic diseases than the miasmatic problems. Minimize. I'm not saying completely removed. Minimize.
Always in high potency, sir.
Yeah. Usually constitutional remedies acts in a higher potency is better than lower potency.
At the time, no sorts.
No, yeah.
Coming as constitutional remedy means very high potency, 10 and above.
No, you can start from a lower potency also, but it gets complete effect or a better result when we go to the higher and higher potencies.
Very nice
Thank you.
presentation, sir. Very nice.
Thank you. Thank you.
Sir, it's the time to wind the session, and it was a very fulfilling session. And we expect more from Dr. Jose, sir. And on behalf of IFPH, I thank Dr. Jose, sir, for presenting such marvelous a session. And thank you all for listening this session. It's time to start the Malayalam. Over to Dr. Shaila for the Malayalam session.